using those as aids in therapy.
I know that you've worked for quite some time with the United Way of Broward County Commission on Substance Abuse, and they have been in the forefront of raising the red flag here that we had a problem developing. How encouraged are you to see now that in Tallahassee legislators are in fact listening?
Well, thank you for mentioning the Commission on Substance Abuse. It, along with other drug coalitions, drug-free coalitions in South Florida, particularly the United Way Commission on Substance Abuse, the Miami Coalition for a Safe and Drug-Free Community in Dade County, and the Palm Beach Coalition have all been active groups exploring this issue, but particularly here in Broward for over 6 or 7 years. This group has been at the forefront of moving the prescription drug monitoring bill that finally passed this past summer, and is in the process of being put into place to go into effect hopefully in December of this year. Because it took a long time and it took a lot of convincing, people were afraid of another public database and other issues related to that. But we were successful in getting that particular bill passed, along with state allies. The Commission on Substance Abuse has also really brought this issue to the forefront. Your work and WSBN has been at the forefront of that, and also prize-winning coverage. We need to let it be known, and it's that information as well as our print media locally has also been over the past year very active in this. That attention to the issue led to a special grand jury in Broward County looking at the issue with the whole list of recommendations. And while we do remain the epicenter of the pill mill phenomenon, we were one of the few counties in the state that actually saw a reduction in the number of pill mills in the most recent reporting period. We were one of the few counties in the state to show a reduction in the number of those pills dispensed, even though they are in the millions. And very pleased to report in 2009, we have seen downturns in the number of deaths and other serious consequences.
In Broward,
in
not statewide.
Specifically.
Right, but that doesn't hold statewide.
No, it's not hold statewide. So, I know we're far from finished, we're far from declaring success, but at least the efforts that have been going on here have started to make a difference and are becoming models for other communities in the state and hopefully for the entire state.
Dr. Omi, I was wondering, how do you tell the difference between someone who wants drugs and someone who needs pain medicine?
Well, that's a very good question. Obviously, the difference is really tough to do, to draw on any single interview, I think. What we have to look at is their pattern of drug use over a period of time. And the only way to do that is either by working with the patient over a period of time, being conservative in the prescribing, and or tracking down records and being able to establish the pattern they've used with other practitioners. The big problem there is, of course, and perhaps the new law will address this, is finding out who's writing what for what patient if the patient's not going to tell you. And patients can be extraordinarily convincing. As we all know, addicts can be very good at convincing us they aren't addicts at times. And so there isn't a simple answer. It involves a lot of diligence on the part of physicians, and hopefully better interchange of information will be coming.
When you see a clinic setting where there are dozens and dozens of people in and out of the door, and many of them from out of state, which doesn't mean if you're in state that it's not an issue, because we have people with problems who live in Florida. But when you see all of these vehicles from other states, isn't that a red flag that something terrible is going on here?
It is to me. You know, it was striking. I know I happened to stop at a traffic light a few weeks ago next to a pharmacy that said they wouldn't fill prescriptions except for people with Florida IDs. So part of your residents may be out of luck at that particular pharmacy, but at least that's a pharmacy that's making an attempt.
Right. We have also heard that some doctors at some of the pain clinics have said, we don't treat people from out of state. But then on the other hand, it's pretty easy if you want to get a bogus Florida identification. So that's no guarantee either. So it's really, it's up to the doctor, right? Bottom line.
It's up to the doctor.
Mr. Ferrero, from a legal point of view, when a pain clinic is operating to do good works, and a pain clinic that is operating to be a pill mill, how does that happen legally?
It happens mainly because there's no law to regulate. And I think one of the reasons why we have